Welcome everyone, and thank you for joining us for today's session, in which we'll look at unlocking your future in health and data science. I will be co-hosting the session today, guiding you through the different pathways available to help you build data and AI skills and how they can support your long-term career development. Lars will be sharing his perspective as a health data scientist working in the field, giving you a real-world view of what this looks like in practice. Together, we will give you both a big picture and on-the-ground perspective of how these skills can shape your future. And over the course of the session, we'll explore some of the latest trends in data and AI in healthcare, including growing need for secure environments, show how apprenticeships can be a powerful launchpad for your career, and share tips on sustaining success whilst learning, and also with the support of and mentorship at every stage. There is a Q&A section on the webinar today, so feel free to ask any questions in the chat in that function. And also, if you guys would like to upvote any questions, we can start off with those when we get round to answering the questions at the end. Here's a quick overview of what we will be covering in today's session. In the next 45 minutes, we're going to explore three key themes. First, we'll dive into the emerging trends reshaping healthcare data science, so from the latest advances in data analytics and the growing importance of these environments and the governance when working with these sensitive health data. We'll then shift the focus of your career, shift the focus to your career trajectory and how structured training can be a powerful launchpad into health data science with real stories from professionals who have progressed this way. And finally, we'll talk about sustaining success whilst learning, so practical ways to balance career growth with ongoing study. So let's get started. And before we dive into the content, a quick introduction from us as your speakers. My name is Tanu. I work in the NHS and public sector team at Cambridge Spark. In my role, I work with NHS Trust to support workforce development in digital data and AI skills, so making sure teams have the right capabilities to meet challenges of the future. And also, I work at Cambridge Spark. We see firsthand the impact of learners, particularly for me in the NHS, gain new skills. So that is not just technical, but it changes how teams work and ultimately improves patient outcomes. That's a little bit about me. I'll hand over to Lars, who can quickly introduce himself and share more about his background.
Hi there, my name's Lars Murdoch. I'm a health data scientist at the British Heart Foundation Data Science Centre. I've been working in health data for 8 years, so I'm not early careers, but I have been helping a lot with HDR UK's internship program. So hopefully I can offer a lot of useful perspective on what it is to be early in your career into health data. So yeah, it's great to meet you and looking forward to talking more.
Thanks, Lars. And from here, I'll just hand over to Lars to go through his bits of the session today.
Fantastic. Thanks very much, Tanu. I'm just going to test moving the slides along just to make sure that it's working fine. Is that working fine for you, Tanu? Fantastic. Okay. So many of you might have caught a presentation from my co-worker, Fiona Chalmers, last week. I thought this was an excellent introduction into health data science. So what I wanted to do for you guys today is to build on that. Please do go back and watch her presentation if you didn't catch it. Here I'm going to talk a little bit more about the opportunities and challenges of health data science, both from a sort of perspective of someone working in it, but also in a more top line, what the field may look like in a few years' time. I will try to tie this together with some of what Fiona's talked about. She mentioned that there's maybe the career sits in the intersection of quantitative skills, programming skills, and health knowledge, or we can kind of shorthand that as health, data, and science. So the three kind of pillars. And given I'm aware many people in the room will have come from maybe one of those perspectives, but not necessarily have a lot of experience of all three, I'm going to try and fill in maybe some of the gaps and just talk about some of the most useful stuff. There'll be plenty of time for Q&A afterwards, so you'll see me skipping some things, but that's just content that might be useful if it comes up in the Q&A. Cool. So for those less familiar with the science part, the sort of process that's important for health data science and how we conduct research. I'd like to talk a little bit about that. And I'm going to use an example here. Early on in my career, I started in health data science. However, a friend of mine started in e-commerce data science. So they weren't working for Amazon, but I'm using Amazon here as an example. If they wanted to make changes to affect an outcome, such as number of people buying products, they can modify the website and see what sort of nudge effect that has. They do something called A/B testing. So they direct some people to one version of the website, other people to another version of the website. It may only contain a small change, but then they can see what impact that has. So for e-commerce on the left-hand side, there's a whole list of things that are advantages and affect the way they conduct that process and the skills and considerations they need to have. There's a lot of things that make life easier for them. For example, it doesn't really require ethical approval. They have immediate access to the data. They can quickly spin up and change these websites. They have such a high volume of traffic that they will see changes, if there are going to be any changes, within a day or two. They are chasing a single metric, so profit most likely. And then if they find that it has been profitable with this tested environment, then they can roll that out the following week. And this is a story that my friend had, and he essentially was able to do these things week to week. In the world of health, it's very different. We don't refer to these as A/B testing. It's more likely called a trial or randomly controlled trial. However, we can't always just test out whether a certain surgery will work on some people or exposure to a disease, what impact that will have on healthy people. We can't introduce those interventions. So it means a lot of the time we are trying to follow things that are naturally occurring and then try and spot the patterns, spot the connections. We're not changing the things ourselves. So there are some examples in limited situations you can conduct a trial, but it does require ethical approval. It requires months, sometimes years of design, development, funding, recruitment. You may then be waiting for years to see what the outcome of those changes are. It can be a volume of only a few dozen people. Sometimes some trials are very, very expensive, so very small. And you have to consider lots of stuff, not just a single metric. You have to consider their general well-being, the cost efficacy, whether there's practical implications, things like that. And the time to adoption can be years or decades. So you really have to be aware of that. In the world of health, it is quite different to how you'd conduct anything related to data science compared to, for example, e-commerce. You hear a lot of tech leaders say, move fast and break things. I'm sure we can imagine that's not something you want your doctor to be saying. So there's a very different perspective there, and that's why data science in health will move a lot slower. It might lag behind on some frontiers, and there might be completely different skill sets and considerations. An example of this, just to give you an idea of the timelines, is around in the 1950s. They did a study called the Doctor Study, establishing the link between smoking and lung cancer. They actually only could study doctors rather than patients or member of the public, because they had to gather this data in themselves, and doctors were much more willing to provide it, and plenty of doctors did smoke. Very quickly, they did see the differences between smokers and non-smokers, and that's how the link was established. But if you look at this time frame, actually smoking intervention took a very long time, and we went from maybe 65% of men smoking back in the 50s to still around 15%, somewhere in the teens today. So this story has taken 70 years to play out between the point in which we start studying a link to the point in which we're well underway to making changes, but haven't fully done that yet. And if you want an example of sort of how it's played out so far, there's a bill going through government at the moment looking at basically introducing a rolling ban. So that would be the first smoke-free generation. But if those are, if it affects people that are born from 2009 onwards, anyone from 2008 can still smoke. Those people will be starting to smoke now, because it's often adopted when you're in your teens and 20s, and those people may still die from smoking when it gets to 2050 or so, 2060. So this journey from the first point we've realized to the last generation of people to die from it, that's taken 120 years. So you can kind of see the differences between the speed at which some areas of data science can move and others can't. So I am going to talk about slightly cheerier stuff, faster progress, just because some of my background's from cancer and there's a lot of examples in there that I'm going to talk about that, but there are plenty in various other aspects of health. I think it's helpful to know that a lot of the interest is in exposures, is in prevention. And so you'll find, yes, tobacco is considered one of the biggest preventable causes of cancer death, for example, and that has been a long journey. However, alcohol is something that's already being tackled. I'm sure many of you are aware of a lot of new obesity-related drugs that are coming through to market and have shown signs of success. And there's plenty of other things like cancers related to infection. Well, if you can create vaccinations for those infections, then you can drive down the number of cancers. And with the HPV rollout, vaccination rollout, there has been a lot of success there. So it's not a case that everything has to take 120 years to really see the full effects. A lot of positive changes can happen sooner and are happening sooner. So hopefully that's something to raise your spirits when it comes to prevention. And there are a lot of other areas that do move a bit quicker. I do have a video for this, but I think just for timing, it's worth talking about as a still. Hopefully you can see that on this graph, it's the age pyramid of the UK. Right now it's looking at the 1950s. So if you look at the bar for 40-year-olds, it's about 4 times longer than the bar for the 80-year-olds at the top. As we've got better at keeping people alive, if you would play this video through, you would see essentially the number of 80-year-olds gets proportionally higher and higher. We have a far older population today than we've ever had before. This is true for a huge number of countries, particularly sort of Western developed countries, and it creates a different health burden. We might be better at keeping people alive, but that's not necessarily a case that we're keeping people healthy. So we're starting to see a mixture of patients with a lot of complex needs and also a high burden on the NHS. Fewer people contributing taxes and working in the NHS because there's relatively less people of working age. I worked out that when I will be 80, the bars will be roughly even lengths. So let's say if you have roughly the same number of 40-year-olds as 80-year-olds, then it starts to change your priorities and starts to change the demands on healthcare. I would also draw your attention to some of the priority areas, because a lot of the time when you're working in health, you are looking at a specific disease. I would suggest you have a look around, maybe follow the links given here. A lot of the priority areas will be ones where people are typically dying, or areas where they sense that a lot of research has been done or could be done, or a lot of interventions are ready or would be impactful. So nice to have a few there, such as mental health, women's health, and sort of diabetic conditions. They could have, they might be lagging and they might have a really strong impact they can have on the economy, for example, but it might not perfectly correlate with the causes of death. Whenever you do see rankings of causes of death or other diseases, just keep in mind that how you group things does affect stuff. For example, if you gather together all the cancers, that would bring it to the top, or if you gather together all the heart conditions, they would then be at the top. Or it might be a temporary thing. For example, COVID from this 2021 table is very high. I imagine 5 years before, 5 years after, you wouldn't see that. So priorities do change, and they aren't always based on what's the most severe health condition to have. They might be based on what's the most impactful. We can come back to that a little bit later if there's questions on it. I'd like to basically frame this from anyone who is less familiar with the coding side, because I think we tend to have people from the health side who are interested in getting into the data part, maybe don't have much experience coding. And I'll just go on to say data science is a very umbrella term. This infographic shows somewhat the sort of spectrum of the data lifecycle from exploration to analysis. There's a lot of machine learning parts in there. Any one of these job titles could apply to any of them, and I don't think it's always used very consistently. So if you are looking online at particular roles, look at what the role entails and focus a bit less on the title. I'm going to talk a little bit about the ML parts later on. I'd also say if you're looking at the tech stack, I realize this will be small on a lot of people's screens. It's basically just all the logos you could imagine in the ecosystem, but this is something that if you Google what tech is involved in data science, you will be treated with something like this. This is not specific to health data science, and it will feel very, very overwhelming. You do not need to learn all of this. I'm going to talk about basically the small aspects I'd recommend starting with. However, I recognize maybe about 5 or 10% of this and have used less than 5% of this. So just because you see a lot of people name dropping a lot of things, it does not mean that that's an expectation on you, nor is it practical for everyone to be familiar with every aspect of data science. So I'm going to just pre-answer some questions that come up a lot in some of the work I've done with early careers people in the past. Do you need to be able to code to work in health research? Not in health research necessarily. There are project management roles and governance roles, etc. However, do you need to be able to code to work as a data professional? Yes, I'm hedging myself by putting probably in there because of the governance part. People might have the word data in their job title, but don't need to code if they're very specifically part of the governance aspect. For everyone else, yes. And by coding, I mean probably more than sort of Excel or any kind of drag and drop. If you've worked with Power BI or Tableau, that kind of stuff, it's a nice start. It's a good way to sort of get some interest in it. But I think you will need to consider coding as an option if that's what you want in your job title. Is learning to code difficult? It seems to be that people from a maths, physics, computer science background, yeah, they'll take to it pretty quickly. But from what I've seen with new starters who are completely new to coding, it's not always the case that you have to have that background. I think if you like problem solving, if you're patient, if you're resourceful, if you're inquisitive, that goes a long way. So the best advice I have is just try it and find out, see if it's for you, because I think it's pretty essential. It's better to know sooner, and if it turns out it's something you love, then you have that in your life earlier. Which languages? Python, I'd recommend if you're from a sort of a generic discipline, or if you don't have a specific focus in health. I think it's the most useful. I personally prefer R, and I think if you do know you want to work in health, then that's going to be the more useful thing for you. I think R is just a bit easier, but in terms of, these are both like bread and butter languages. They're object-oriented programming, which means they'll transfer to a lot of stuff. So similar to how I don't know, if you've learned if you learn Spanish, then it's maybe a bit easier to learn Portuguese. I think it's a similar concept. I'm going to do a bit of myth busting here. Do you need to know lots of coding languages? No, I showed that whole collage of logos. I don't think you need to know many of them. I'm only familiar with a few. I have a strong preference for R and know a little bit of some of the others. They're very transferable, but you'll see the way people do coding development now is more about how you engineer a prompt or how you Google things. You don't need to have an encyclopedic knowledge of all the functions. You just need to be able to sort of know how to find the information about it when you do need to use it. So that's the best advice I have. Try and be fluent in one key language, so R or Python. And then if you get a chance to play around with some of the others just to see what the similarities are, then yeah, that's a good point. Is there a lot of machine learning in the industry? Some. I think people talk a huge amount about AI and machine learning, and yes, if that's something you want to do, there are a lot of data science jobs that do involve that. People tend to want to upsell or sort of aggrandize what they're learning. I think in health, for some of the reasons we covered at the beginning, it does lag. Data privacy sort of is at odds with open sourcing here, so it sort of means that the machine learning aspect of the health industry is very new and still maturing. I think there are probably more jobs that don't involve machine learning than do. So for those of you that are a bit intimidated by this, don't have a background in machine learning, that's fine. I don't think you need that. look into ChatGPT, but you don't need to be able to design your own machine learning algorithms. For those that are interested, then that's great. There'll be opportunities that come along, but just make sure you keep an eye out on the role profiles. And I think that draws us to the end. There's some links here I think we'll come back to that are courtesy of HDR UK. And just to say, a lot of what I do, as Fiona mentioned in last week's presentation, it's linked to a lot of institutions and a lot of data providers, a lot of charities. There's a lot of big players in this industry, and it is all very team science. So at the start, I mentioned long time frames involving making actual positive changes in healthcare, and that's wonderful. It does mean you do have to work with a lot of people because you're only part of a long process. So yeah, shout out some of these, but the main point is it's a team science endeavor. There's no egos or individuals involved. I think we're on to the apprenticeships part. So I'm not sure who I'm handing over for this.
I'll take over from here, Lars. Thank you. Yeah, I'll take you through the apprenticeships and talk through more about that in detail. Just wanted to quickly highlight, if you guys have any questions for Lars on a couple of bits from the previous section he presented, feel free to post them in the Q&A section, and we'll get round to answering your questions. So at Cambridge Spark, apprenticeships are one of the most effective ways we help people and organizations build lasting capability in data and AI. They're fully funded in England through the apprenticeship levy or co-funded for smaller organizations. So employers can access high quality training at little or no cost at all. In terms of eligibility, you need to be employed in England and be able to dedicate time to learning alongside your role, which is why these programs are so effective at combining study to real world impact. And what makes apprenticeships unique is the applied work-based learning model. So you don't just study theory, you immediately put new skills into practice into your role. So delivering real outputs like dashboards, predictive models, or automated processes that save time and improve decision making. That will also ensure that it directly connects to the emerging trends within the healthcare space, such as predictive analytics, automation, secure data handling, and apprenticeships will look at providing the skills that you need to engage with these trends and make a real impact within your work. And for learners, apprenticeships are seen as a launch pad, let's say, for career progression. So with the programs from entry-level data citizen through to advanced AI engineering or data science pathways, there's a clear route that grows into more specialist and impactful roles. And what really makes the difference is the support. So at Cambridge Spark, every apprentice or every learner will get a dedicated success coach and a data mentor alongside the access to technical specialists. So this means you're not guided just on the learning itself, but also on how to apply it to your projects, how to sustain success over time. So apprenticeships aren't just about teaching skills, but they're looking to help learners grow their careers, support organizations to keep pace with the healthcare trends, and also build long-term capability to power the healthcare sector for tomorrow. So on this slide, it really brings to life what we mean when we say apprenticeships can be a launchpad for career development in health data science, while also building a long-term capability the healthcare sector needs. So we'll start off with David Howe, who is the Joint Director of Strategic Insights and Analytics at Surrey Heartlands NHS. So through this level 7 apprenticeship in data science and AI, he built a machine learning model that can predict up to 70 to 80% of emergency readmissions. So this is not just a technical achievement, it's an example of how predictive analytics, one of the emerging trends, can directly shape strategic decisions and improve efficiency. Then if we look at Rachel at Northern Care Alliance, she progressed through our level 3 data citizen and then onto the level 4 data analyst apprenticeship, automating reporting processes that saved 384 hours of nurses' time and nearly £9,000 in costs. So beyond the organizational benefit, this positioned her for recognition and career progression, showing how apprenticeships can be a true reflection on career growth. And finally, Joe Hollingsworth, an electrophysiology coordinator, he used the level 4 data analyst apprenticeship to cut patient referral times by 75%. So reducing reporting from 5 hours to just 15 minutes. And that's a powerful example of someone stepping beyond their day-to-day role to drive real transformation within patient care. Now, not shown on the slide here, but something interesting I'd like to cover within this slide is the organizational impact we've seen within the NHS trust that we work with. At Guy's and St Thomas Foundation Trust, over 200 staff across 20 departments are now enrolled on their Data and AI Academy, so supporting a long-term strategy through to 2030, and also saving £62,000 on recruitment costs thanks to internal promotions. And at Great Ormond Street, apprenticeships at Gosh are helping transforming care for 76,000 children. Ultimately, what it's doing is improving outcomes through faster admissions, earlier diagnosis, and reducing the need for life-changing surgeries with the implementation of AI. What's important is that all of this happens while people are working full-time in demanding NHS roles. So that's the unique strength of apprenticeships. With structured workshops, mentor support, and on-the-job application, learners are able to balance career growth with ongoing learning. So it's a model that makes success sustainable, it's not just the short-term gain. So across both individual stories and trust-wide initiatives, apprenticeships don't just teach skills, they unlock careers, they equip people to engage with the biggest trends in healthcare data. And also they ensure success can be sustained over time. And this is how we build data and AI capability to power the workforce for in tomorrow's NHS. When you enroll in an apprenticeship, it's crucial that the time you invest brings real value and rewards. So at Cambridge Spark, we break the learning experience down into 4 key pillars, all of which is or are essential for ensuring you get the most out of the program. The first is learning, so weekly workshops led by expert faculty. These cover the latest data and AI skills shaping healthcare today, from predictive analytics to automation, and will give learners the foundation to apply them to their role. Next is experimentation, so new skills that you practice. So we provide our Educate platform. It's a safe and simulated environment space to build confidence before applying them in real healthcare settings. Then we've got the third pillar as application. So everything you learn is applied to real projects in your role. So creating a portfolio of tangible outcomes that will benefit your team, your organization, and your career as you progress through these apprenticeships. And finally, there's support. So each learner has a success coach to keep you on track and align learning with their goals, plus a data mentor for technical guidance. That support makes it a possible balance between the study with work, and a sustained success for long-term after the program. So these 4 pillars don't just teach knowledge, they look to engage with the healthcare data trends, deliver impact, and unlock career growth in a supported and sustainable way. Here you can see an overview of the typical time commitment across the month. So on average, you will dedicate 6 to 8 hours per week to the program. The time that's built into your contracted hours, so ensuring the learning complements your role rather than you competing with the time and the learning within the hours. So this breaks down into 3 parts. First is the structured learning, or what we also refer to as flexible e-learning. So there's 2 to 3 hours, or on average 3 to 4 hours a week of pre-work assignments on Educate and optional modules. You then have workshops. So these are about half-day workshops. It depends, the frequency of the workshops depend on the type of program you enroll on. So for example, the level 3 data citizen, it's once every 2 weeks, whereas the level 4 data analyst, it's weekly, so once a week. You will join a virtual session with the rest of your cohort. It's led by the data mentors also, and they'll cover material for that particular week's module. And the final part is the work-based learning. So applying what you've learned directly into your day-to-day role, whether that's building a dashboard, automating a process, or applying secure data practices. I'd say the benefit of this bite-sized approach is that you steadily build up your portfolio, and by the end, you already have a body of experience or evidence showing how you've applied your skills in a real healthcare setting. and it's a powerful launchpad to showcase development, career progression, and also when it comes to the apprenticeships, if you're able to showcase impact is where we find learners achieve the distinction or merit. And importantly, this design makes the program sustainable because the progress is incremental, it's supported by data mentors, and it's flexible enough to be accommodated around busy schedules. So you can be learning within your and keeping the pace with the latest trends in healthcare data and AI. When we talk about time commitment, it's not just about the hours you put into the apprenticeship on a weekly basis. It's about the shared effort between learners, line managers, and Cambridge Spark to achieve the real business impact. For the learner, the commitment is around 6 to 8 hours per week. So that time is spent in workshops, practicing on Educate, and applying the skills directly to projects. By doing this consistently, learners not only keep pace with the emerging trends, but they also build a portfolio of tangible outputs and becomes evidence for career progression. But for the line manager, the commitment is to provide space and encouragement for learning. So that means allowing protected time, supporting learners in applying the skills to meaningful projects, and recognizing their progress. So with this support, the program becomes a sustainable way for learners to balance study with their role and deliver impact at the same time. And for Cambridge Spark, our commitment is to provide the structured and support that makes this possible. So expert-led workshops, the Educate platform for safe practice, and the one-to-one guidance from coaches and mentors. So together, these commitments ensure the apprenticeships deliver measurable benefits from improved patient care to greater efficiency, while also enabling learners to sustain successes and grow their careers ultimately. Educate is our award-winning browser-based learning platform. That's one of the reasons learners on our program achieve such strong results. At its core, Educate provides a safe, simulated environment where you can practice new skills, experiment with different approaches, and build confidence before applying them in your role. So that means you're engaging with the emerging trends in data and AI, predictive analytics, automation, secure data handling in a hands-on way without the risk of making real mistakes in a real world systems and processes. And what makes Educate unique is its instant personalized feedback. So within 59 seconds of submitting a task, you get targeted guidance on how to improve. The rapid cycle of trying, getting feedback, and refining your work accelerates your learning, helping you make visible progress week by week. Educate is also a central hub for learning, so it brings together all the workshop resources, a dashboard to track progress, a knowledge base with expert answers, and even peer spaces where you can ask questions and share best practices. Although our programs are delivered remotely through live sessions, Educate makes sure the experience stays interactive and collaborative, so something many learners really value. And importantly, Educate supports sustained success. You'll continue to have access for 6 months after your program. So this means you can revisit modules, refresh your knowledge, and keep building the confidence as you progress within your career. And it will also ensure learning is not just a one-off event. It's something you can carry forward and keep reinforcing. And that's why Educate consistently receives some of the most positive feedback across our programs, and why it's been recognized with awards like COGEX Award for the best AI education platform. And it's a key part of how apprenticeships not only give you the skills for today, but also confidence, support, and momentum to grow your career and deliver impact for tomorrow. So that brings us to the end of today's session, and we've explored emerging trends reshaping healthcare data science, how apprenticeships can act as a launchpad for careers, and how learners can sustain success through ongoing support and mentorship. As this is the second of two sessions, I'll you take take the ideas and we've discussed, think about how they could apply in your own team and your organization. And of course, we'd love to continue the conversation, and I would like to invite Rosie back on stage just to share a couple of words.
Thanks, Tanu. And thank you so much to you and the team at Cambridge Spark, and also a massive thank you to Lars for providing such a great talk today. So yes, just a few a few final things from me. I just wanted to draw your attention to the Health Data Research Futures online training platform. There's a QR code on the left here, which is our online learning environment, which contains hundreds of health data science videos, self-directed courses, webinar recordings, all completely free and on demand. So if you haven't had a chance to check out Futures, then I highly recommend it. You may see a few familiar faces on there as well, as Lars is a contributor to the platform. And on the right-hand side there, you can just see some live training events that we have coming up, some live workshops and webinars later in the year. We have a busy calendar of training and other HDR UK related events on our website. So do check it out, and we'd love to see you at some of our events in the future. So I think that is us all pretty much at a close. If we didn't get to your question today, then I've just put our team's email address in the chat, which I'll do again, so it's at the top of the chat for everyone. Do just drop us an email if you've got any questions to do with health data science, training or careers generally. We'd love to hear from you and be really happy to answer any questions. So yeah, I think that's pretty much it. Thank you so much for spending your lunchtime with us today, and hope to see you at another event soon.
Thank you, everyone.